Hi, this is Dr. Slave Gallagher. I'm a plastic surgeon with special interest in gender confirmation surgery. I'm answering a question I actually just got asked yesterday, and that is to talk about the effects of binding and surgery. Patients worry, and there's a lot of concern out there that overuse of a binder or just using a binder before gender confirmation top surgery will cause problems for the surgery itself. So I don't really subscribe to this. I don't really think binding causes much of a problem for your top surgery. There's two possible things it may influence. The first would be the more droopiness a patient has, the more likely that they're going to need a double incision procedure. And usually if the patient has any sort of droopiness, it's best to go with a double incision procedure as opposed to a keyhole procedure where we're relying on that skin to shrink in. So in some cases, maybe if a patient has been using binding and kind of crushing down that breast tissue, it is possible that theoretically, if they've never bound, that they may have been a candidate for keyhole surgery. Again, I don't think it makes much of a difference. So that's the first thing it can possibly influence. The second thing we see sometimes in patients who've been binding for a long time is that they will have these little pockets of fat that we see just typically right here above where the binder kind of digs in. And so there'll be two little pockets of fat. And sometimes this isn't addressed by the standard surgery, the double incision surgery. Usually it smooths out when everything is pulled down, but sometimes we have to do a little bit of extra, and that would mean liposuction in order to get rid of those little pockets. If the little pockets are still there after surgery, there's a few little tricks we can do to get rid of them, but those are the only two factors I really see. And again, as I always preach, everything we do is a risk and benefit analysis, and again, to ask a trans guy never to bind is, you know, a very tall order, and I really don't think it's worth it. If binding helps with your dysphoria, absolutely go ahead and do it. Of course, within reason, not overwearing that binder. But I don't think in general you're going to do much harm and change your results from top surgery. I hope this helps.